Because of the minimally invasive technique that I use, the patient essentially was recovered within a matter of about 7 days. He had returned to pitching between 2 and 3 weeks after the procedure and was playing again professionally within 3 months of the surgery. Spinal problems really can come from anywhere. Certain sports activities can cause injuries to the discs in the neck and the lower back. It does not necessarily have to be contact sports. One of the better examples I can think of is I treated a professional pitcher and he suffered a herniated disc in his neck because of his approach to pitching and the way that he threw the ball due to repetitive movements. We were able to do a very minimally invasive discectomy and fusion operation on that patient. The decision was made to do a fusion rather than a disc replacement because of his style of throwing and the forces that he was putting across his neck. I felt more comfortable putting a more stable device rather than a mobile or motion-preserving device in this particular situation. Because of the minimally invasive technique that I use, the patient essentially was recovered within a matter of about 7 days. He had returned to pitching between 2 and 3 weeks after the procedure and was playing again professionally within 3 months of the surgery. And this is really a typical result, and I say, well, he returned to professional sports, but we all need to get back to work, whether it's pitching or it's driving or it's working in an office. So we like to do these procedures that get people back to activities faster and comfortably and with minimal use of pain medications afterwards. And fortunately, a lot of these procedures don't really require extended rehabilitation or physical therapy. A lot of things can be done at home with some home stretching and some home exercises, and patients are recovered because the surgeries that we do are essentially corrective and restorative. So there isn't a lot that you have to rehab afterwards. It's not like, say, a hip replacement or a knee replacement where you're displacing muscles and reattaching them, and then those muscles need to get reacclimated to the new situation and be strengthened again. Essentially, we're not really moving those muscles out of the way. We're certainly not detaching them or reattaching them. We're just working around them, able to fix the spine problem and keeping everything else intact. So this really helps to get patients back to work as quickly as possible. To find out more about orthopedic spine surgery or to seek a consultation, please go to my website, www.totalspineandsportscare.com.